Hello viewers. How are you? This is Rishi. A study of people who visit our clinics shows that diabetes patients are the most common. So today we will talk about how to manage diabetes. What is the diabetes? Diabetes is essentially a circumstance when it influences the body's blood sugar degree, which brings serious fitness issues. Yes, it is actual that diabetes is now not curable, however it can be managed to keep away from serious fitness issues. There are two sorts of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune disorder in which the physique isn't in a position to make insulin. In type 2 diabetes, the physique isn't capable to use insulin as tons as it desires. Diabetes can be remission when diabetes is in a remission state. Free articles, the body does not show signs of diabetes. The emission level is defined on the A1C level. It should be below 6%. It indicates the blood sugar level of the last 3 months. Different varieties of remission. 1. Partial remission, when an individual has maintained a decreased blood sugar degree for a year besides any medicine. 2. Complete remission, when a character has maintained a regular blood sugar degree for a year besides any medicine. 3. Prolonged remission, when entire remission lasts for at least 5 years. Even you are preserving blood sugar tiers for 20 years? It is nevertheless known as remission. Gestational diabetes, for the duration of pregnancy, change your way of life. If struggling from type 2 diabetes, a diabetes-affected person can break out issues of the ailment with the aid of adopting a healthful lifestyle, eating regimen and bodily activity. But if the sickness is taken lightly, it can also be pretty hazardous and even life-threatening. Diabetes, if goes omitted and untreated for an extended duration, can result in serious cardiovascular disorders. Dearth of insulin motives LDL cholesterol to go with the flow in blood and clog arterial passageways, main to coronary heart attack. This is the cause for 80% of deaths due to diabetes. Renal failure, retinal damage, and neuropathy additionally appear due to diabetes. However, high-quality administration of the sickness can make the affected person much less susceptible to serious complications. Some approaches to control diabetes correctly are given below. 1. Treatment and medications. Insulin injections are usually recommended for type 1 diabetes. For type 2 diabetes, oral medications are prescribed by doctors. The common medicines prescribed include Avendamid oral, Amaryl oral, Lantus subq, Byetta subq, Kazar oral, etc. 2. Herbs. Diabetes can be treated with the help of some very beneficial herbs. Cinnamon, bitter melon, quinoa, sylvester, onion, garlic, fenugreek, blueberry, Asian ginseng, ginkgo biloba, banaba, etc. are useful herbs for diabetes. Many herbal supplements are composed of these herbs. 3. Exercise. Exercise is a very effective, rather foundational diabetes management technique. Flexibility or stretching exercises are needed. They improve joint flexibility, range of motion, and balance. Aerobic exercises like walking, jogging, cycling, biking, and skiing are quite essential for diabetics. Such exercises effectively burn down calories, help one to shed pounds of flab, and thus allow metabolism to run properly. 4. A diabetic should take a moderate amount of carbohydrates, at the same time keeping in mind the nutritional value of food. Generous eating of highly processed, flavored food is to be avoided, for they supply the body with hordes of carbohydrates, and an increased amount of insulin production takes place in response to that article search, slowly making the body cells non-reactive to insulin by turning off the insulin receptors. I hope this video will help you know some of the effective and practical tips and methods to control your blood sugar levels. Thank you for watching.